guys, welcome back to my channel. My name is Khadija Tadeshola, and in my channel I talk about everything related to women and midwifery. So today I'll be talking about another aspect of midwifery, which is basically I'll be discussing about the overview of NMC OSCE for overseas registered midwife. So I know that quite a lot of people are just coming to the UK, and because the all UK, they just started recruiting international midwives. Most trusts do not have the maximum support for midwives preparing for their OSCE. So I'm just in this video, I'm just discussing about the overview of the NMC midwifery OSCE, what is the entails and what is expected of you as a midwife that is preparing to write your OSCE. So if this looks like what you are interested in, kindly stick around, watch this video till the end, and if you like it, don't forget to like, comment, share and subscribe to my channel. Please engage in my videos so YouTube can recommend my videos to people looking for this same type of information, because I know that quite a lot of people that actually need this information out there. There are over 1 million midwives all over the world. So please share my videos with colleagues and engage in this video. Thank you. To all my returning subscribers, thank you so much. I really appreciate your support so far in this channel. So back to business. So we're discussing about the overview of NMC OSCE. The NMC OSCE itself is a way of really assessing the international midwife, and is like the second part of the test of competence. Most of the time before you come to the UK, you do your first part of the test of competence, which is the CBT, and after passing your CBT, the last part is the OSCE. Basically, you can do it in no particular order, but what people tends to do is to do the OSCE last, because the OSCE is the only one you cannot do anywhere in the world. It's only in the UK, and currently there are 5 centers that do offer the OSCE in the whole of UK. It was previously 3, but now it's 5. They added Ulster and Leeds to the existing 3. The existing 3 was Oxford, Northampton, and one other one. Well, I can't remember for now. No, Northumbria, sorry, and there's another one which I can't remember for now, basically. So basically, right now there are 5 centers that do offer the OSCE exam in the whole of UK, and that is why. And the exam is only done in the UK, and that is why most people tend to do the OSCE as the last bit of their migration, wherever, registration process and all of that. So the whole of OSCE have 10 stations. So this video is for you, or is for everyone, midwife or the midwife interested in navigating international opportunities in the UK, interested in looking for jobs, for midwifery jobs in the UK, and who have registered with the NMC already. So this video is for you. At any point, at one point in time, you will be in the stage of writing your NMC OSCE, and it's just nice for you to know an overview, to have an overview of what the the OSCE basically entails. So I do implore you that if you're not looking at writing your OSCE exam soon, basically this video is just what you need, basically. But if you're already preparing for exam, just look at this video, have an overview. If you have any questions, you can always ask under the video or send me an email. So the NMC OSCE for international midwife have 10 stations. It is known as the TOC 2021, that's test of competence 2021, because before 2021 it used to be 6 stations. From 2021 the new OSCE started, which is 10 stations, and now everyone writing the OSCE will be doing a 10 station OSCE. So of the 10 station, There are 4 stations and linked together around a particular scenario, and that is known as APIE. So the APIE is APIE, that's APIE. It stands for Assessment, Planning, Implementation, and Evaluation. So that is 4 stations already, but they are linked to a particular scenario. So when you start the exam, you're going to start with the assessment. So the assessment, they are going to give you a scenario about a woman. It can be any of these I'm about to say now. It can be a woman that come in complaining of abdominal pain, frequency of menstruation, or someone coming in with complaints that are related to like maybe early labor or labor pain or something. It can be that they give you a woman to assess, postnatal visit assessment. So it can be any of such. It can be a case of postnatal sepsis. It can be a case of urinary tract infection. It can be a case of early labor. It can be a case of urinary tract infection or anyone. So that is a scenario they can give you. Another thing that I need to say there is that after booking your OSCE and you've booked your OSCE, the center you book with is going to send you an email, and there will be a way you can access a material, a mock material. So you can go there and access the mock material and look at the possible scenario that they do give in that particular center. So back to what I was saying. So they give you a scenario. It can be any of those I have mentioned, and they will ask you to assess the patient. So in the assessment, you are expected to do a full assessment. So you will do the full blood pressure, respiration, temperature, oxygen saturation, fetal heart rate, abdominal palpation, urinalysis. That is what you are expected to do in the assessment station. However, as you're doing that, there are some other things that you need to do as well. You need to engage the woman. You need to talk about the woman history. You need to to ask her about her allergies, and of course, you introduce yourself before you do anything and all of that. So basically, that is what is expected of you during the assessment station. The assessment station lasts for 20 minutes. So before you start the station, you have the right to ask your examiner for any clarifications or questions if you're confused before you start any of the station. So for instance, if you're starting the assessment station, you can ask your examiner if it will be, it's essential for you to use gloves and apron while you're doing the blood pressure check or something. So the examiner can tell you if it's necessary or not. In my center, I do ask, and I was told that it is not necessary for me to use it, that if I didn't use it, I will not be penalized. So I decided not to use it. Looking at the time that you have and things you need to do, you can try to ask, because it might take some time for you to wear your gloves and apron and all of that already. So that's for the assessment station. For the planning station is 16 minutes. You have 10 minutes to write, and you have 6 minutes to discuss what you have written. The planning station, you'll be using the SBAR. The SBAR is Situation Background Assessment and Recommendation. I will not be going deeply on the SBAR because I have a video that I've talked about SBAR extensively. So if it's something that interests you, kindly check my channel. You see the video. If I'm editing these videos, I can put the link to the SBAR video on the description. So that's it. You write about the SBAR. So basically, the situation is about what the patient has has really presented with, and at what gestational age. It's basically what is happening currently. So if I'm writing my situation, I did say that I'm Khadija, a midwife working in day assessment unit. I've met Joy, who presented today with lower abdominal pain and frequency of menstruation at 36 weeks. That will be my situation basically. So depends on the scenario that you are given. Situation is just what the patient presented with, at what gestational age as she presented with. You can also include her date of birth as well if you want to. Then the background is about significance of previous and present obstetric history, significant medical history, social history, allergies if the patient have any allergies, and you can also put family history as well, significant history that you have noted on this scenario. So another thing is that before you start, they will give you, a book about the patient history for you to just have a chart to look at. I think it's about 5 minutes you'll be given to read that. That is not included in your, main examination minutes. Basically, that 5 minutes is just given for you to read the patient notes. So in the background, there are things that is very important for you to say. It's very important for you to say the patient's allergies, and if the patient is currently on any medications, and the patient present and past obstetric history. After the situation background, the next one is assessment. So assessment is basically what you have done in the assessment station, and that's why they say that the stations are linked together. During the planning stage, you'll be given your meal chart that you charted, that you did during the assessment station. So in the assessment phase of the SBAR, you're writing about the findings you got when you were doing the assessment. So you're writing whether the patient looks well or unwell, whether she's feeling baby movement, what her blood pressure is, what her vitals are, what her abdominal palpation findings are, what her urinalysis findings are, what was her total MER score, and what are your differential diagnosis. Basically, that is what you're doing in assessment. Then in the last one, which is recommendation, you're basically managing the patient. So depending on what her MER score is and what your differential diagnosis had, so that is what you use to to plan the care. So of course you want to say that you escalate to senior midwife or something for obstetric review. You listen to fetal heart rate every 4 hours, commence CTG if she's depending on what the complaint her, take blood samples for further investigation. If it was urinalysis, you send urine for MCU, MSU. If you saw any protein in the urine, you want to send urine for protein creatinine ratio, and you want to educate her about what the discussions, what your findings are. After reading all of this, you have to maximize your time to make sure you've written all of this within 10 minutes, and you'll be able to use the 6 minutes to communicate what you have written to your examiner. The last part of the APIE, which is the next part of the APIE, which is the implementation station. Implementation station is always drug administration, and it lasts for 15 minutes. It is mostly oral drug administration. So you're going to administer medication to the patients you have just, attended to. Basically, they're going to tell you that Joy has not been reviewed by the doctor, and they have prescribed paracetamol or antibiotics or anything. They have prescribed so medication for her, so you need to administer. They have prescribed some medications for her which you need to administer. So you're going to be given the medication administration record chart, and when you're giving the chart, I think I have done an extensive video on the implementation stage as well, so I'm going to put that also under this video. So basically everything you need to do during the drug administration is already stated in that station, which you can watch if you're interested. And don't forget, that lasts for another 15 minutes. The next station, which is the station 4 of the APIE, is the evaluation station. So most of the time, the evaluation station will come that patient that you've been attended to has now stayed in the hospital for 1 day or 2 days, and she's now being discharged. So you have to write a transfer of care letter to our community midwife. In this evaluation as well, you're still going to use the same SBAR. So you're using the situation, background, assessment, and recommendation. In this stage now, situation, it's very, very important for you to introduce yourself. Whereas in the planning station, it is more like if you want to introduce yourself. But in their evaluation station, it's so important for you to introduce yourself in the situation. So your situation will be like, I'm Khadija, the midwife working in antenatal ward. I met Joy, who was admitted 2 days ago on account of urinary tract, who was admitted 2 days ago on account of abdominal pain and was diagnosed with urinary tract infection by the doctor, which has, and was treated with an oral antibiotics. She has had 2 doses already, and she is now being discharged home. Her pain, she has currently do not have any pain. Baby movement has been fine. CTG has been normal, and she's not being discharged home. Basically, that will be my situation. My background will be mostly almost the same thing with the previous one, but obviously, I'm going to add the medication that she's now being prescribed on and that she's not on. I'm going to add it, and of course, I've had if she's got any allergies as well to the background. Then the assessment will definitely be observations and everything as well, just as my previous assessment was. And then the recommendation will be that you ensure that the recommendation is what you want the community midwife is to do, basically. So you should not be that you ensure that she completes her prescribed antibiotics, to continue all her previously scheduled all antenatal visits are previously scheduled, to educate her on prevention of the recurrence of urinary tract infection, ensure to chase all outstanding investigation, and to be reviewed, to come back if there's any concerns with her baby and all of that. So you should basically write the recommendation, and that is the end of your evaluation station. And your evaluation station also lasts for about 15 minutes again. So that's the end of that first part, which is the APIE, and they are usually 4 stations. So the next one will be another a link station. So the link station is lasts for 30 minutes. It tests your practical clinical skills, basically. So the link station can be a case of delivery and postnatal and systematic examination of the newborn, or postnatal visit where you do systematic examination of the newborn as well after checking the mom. So it lasts for 30 minutes, and you can decide to do whichever the first, if you want to assess the mom first or you want to check the baby first. And of course, if you're given delivery scenario, then you basically need to deliver the baby first before you assess the baby. The whole process lasts for 30 minutes, and you will be assessed. After the assessment, you will be given after doing it, you will also be doing documentation, and it's included in the 30 minutes. So you'll be given the male chart to document about the assessment of the mom, and also you'll be given a very extensive documentation, extensive book, basically, to document about the baby's findings. You're going to assess the baby from head to toe, basically, and in the books there's head, there's what you have found out and all of that. So you are okay, or maybe the head is normal, the height is fine, it's normal. Then for the reflexes as well, you want to write present, or absent, depending on what you have gotten when you are doing the assessment. And there will be a space for conclusion. What are your recommendations? So conclusion will be basically maybe everything about the baby is satisfactory. Your recommendation will be that they should repeat systematic examination of the newborn with the community, with their GP in the next 6 weeks. And of course, you want to communicate to the mom if everything is fine at that moment, or you have anything. And as you are doing it, you want to become engaging the mom as well. You want to talk to the mom about health promotion. There's a space you need to document that. So in the health promotion, you want to tell her that she should make sure that everyone coming in contact with the baby wash their hands, active the social history is important. You want to know if she's a smoker, if she's a smoker, you want to advise them to ensure they wash their hands after smoking before coming to carry the baby, if they can change their clothes and all of that. So everything, all of this you have to do within 30 minutes. Don't forget that during the process of your exam, if you need a break, you can ask your examiner that you need a break before you go to the next station. The whole exam lasts for about 3 hours, so you may, if you want to have a break, you are allowed to have a break in between. You can have a break to take some water or something if you want to. So I've discussed about 6 stations now. So there will be another 2 stations that will be one of which will be an acute emergency skills, and the other one can be basically so an acute emergency skills can be like talking about management of postpartum hemorrhage or unexpected breech deliveries. They are an acute emergency situation, and it lasts for 8 minutes. Each of the 2 stations lasts for 8 minutes. They are separate stations, they last for 8 minutes. Most of the time you do not really have to document on this station, but you have to discuss everything. For instance, unexpected breech delivery, you have to talk about the maneuver, the delivery, and after that you have to tell the examiner that you will document everything that has happened, and you will document the brief and there's this 3D I've been mentioning. So basically that is what you need to do. After that, then the station can be postpartum hemorrhage, it can be unexpected breech delivery, it can be soda dystocia. Basically they are acute emergency situation that you need to discuss. It can be delivery as well, so it can be any of those, and they are actually 8 minutes each. Then the last 2 stations will be silent station, where you will be meant to write, to just write. And I think each of them lasts for 10 minutes, and you're just meant to write about, so one of it will be of professional values, and another one can be basically evidence-based. So professional values associated with professional issues associated with professional values and behaviors. They can ask you about how you will attend to a patient that is angry or something, how you will attend to a patient that is delivered and doesn't want to breastfeed, or all of those things. So basically you use your discretion to answer based on whatever the scenario is. And then another one can be clinical appraisal and research associated with decision making. It can be place of birth, basically it can be in this induction of male labor, it can be anything just about you to make a decision about what to do in that situation, where you are in a real life situation, when you are encountered with that kind of patient. So to answer all of these aspects correctly, you need to understand that in the UK, everything we do is driven by patient's choice. So you don't impose your own choices or impression on patient. So you have to make patient to make an informed decision about whatever situation they are in. If a patient doesn't want to breastfeed, you don't need to really force her to, breastfeeding is very important. No, you just tell her about the benefits of breastfeeding, and if she still insists not to breastfeed, you support her decision. If a patient is being offered an induction of labor and she still doesn't want to have it, you tell her about the risks associated with the decision she has made. You document and you support her decision. Basically, that is it. But you let her be aware of the consequences of her action, the possible consequences of her action, and you let her make her decision. You don't impose your own choice on the patient. That's one basic thing about the UK. So you go with whatever they want, but you make sure you have explained everything necessary to them. So that will be the end of this video basically. So in this video I talk about the overview of the NMC midwifery OSCE for international midwife, and I've talked about the whole 10 stations and what you are expected to do in each of the stations. And of course, if you need further query, further information, further support, and extensive support, you want to have a chat with me regarding your OSCE, you are free. You just need to send me an email, which I do not promise to respond immediately, but I'll make sure I respond to your email within 24 hours. If I do not respond to your email within 24 hours, it might mean that I did not see it, so you may need to resend another email, because I've got like lots of email, but I make sure I check emails that come from a specific person, from a specific name, basically. So make sure if I do not respond to your email, you can always resend after 24 hours of no response from me. So thank you very much. And whenever you're doing your OSCE, remember to prioritize people, practice effectively, preserve safety, and promote professionalism. Always seek consent before you do anything. Introduce yourself to patient every time you are having a contact with the patient. I think this confusion usually comes during the APIE station, because it is stated that it's still one scenario, one patient you're seeing. Maybe when you now go for implementation, you don't want to introduce yourself again because you presume you've seen the patient before. This is an exam, is a real life situation, so you have to introduce yourself every time you're seeing the patient. Thank you so much for watching this video. I'll see you in my next video. Don't forget to like, comment, share, and subscribe to my channel. Thank you. Bye.